Here's the most dangerous assumption I see in people over 65, and almost nobody realizes they're making it. They believe that if a medication is sitting on a pharmacy shelf without a prescription, or if a doctor handed it to them years ago and never said a word since, then it must be completely safe to keep taking, day after day, forever. And that single belief is quietly damaging more kidneys in this age group than almost anything else I see. Not sugar, not salt, not even high blood pressure on its own. Common, ordinary, everyday medications that millions of people swallow without a second thought. But before your heart sinks, let me give you the part that matters most. Your kidneys are far more forgiving than people think. Unlike a heart attack that strikes in an instant, kidney damage from medication usually builds slowly, quietly, over months and years. And that slowness is actually good news because it means there is almost always a window to catch it, to change course, and to protect what you have left. I have watched kidney numbers stabilize and even improve once the right adjustments were made, working alongside the patient's own doctor. So this is not a video about fear. This is a video about giving you back control. In my years in practice, I've sat across from countless patients in their 60s, 70s, and 80s who had no idea that the bottle in their medicine cabinet was part of the problem. Good people, careful people, people who followed instructions, and almost none of them had ever been told, in plain language, why these specific medications hit the kidneys harder as we age. So that's exactly what I'm going to do today. I'm going to walk you through 5 medications that deserve a much closer look after 65, explain precisely what each one does inside your body, and show you how to use them more safely without ever putting yourself at risk by stopping something on your own. And I'll be honest with you, the 4th one on this list surprises almost every patient I mention it to, because it's something many of them take to feel better, not realizing what it can quietly do over time. So stay with me all the way through. Before I get into the first one, do me a small favor. If you find this useful, hit subscribe, give the video a like, and leave me a comment telling me how old you are and whether you've ever had your kidney numbers checked. I genuinely read those comments, and they shape the videos I make next, because the questions you ask tell me exactly what's not being explained in the rushed appointments so many of you are getting. All right, let's get into it. First, I want you to understand something that almost no one explains, because once you understand this, every single medication on this list will make instant sense. Your kidneys are 2 small organs, each about the size of your fist, tucked into your lower back. And their job is enormous. Every single day, they filter your entire blood supply around 30 to 40 times, pulling out waste, balancing your water, your salt, your potassium, your acid levels, and quietly keeping the whole chemistry of your body in balance. They do this through about 1 million tiny filters in each kidney called nephrons. Think of each nephron as a delicate little sieve fed by a tiny blood vessel. Now here's the part that changes everything. As we age, we naturally lose nephrons. By the time many people reach their 70s, they may have only half the filtering power they had at 30. That's not a disease, that's just normal aging. But it means your kidneys have far less reserve, far less cushion. When you're young and one of those tiny filters takes a hit, you've got plenty of backups. After 65, every nephron counts. And on top of that, blood flow to the kidneys naturally drops with age, the filters become more sensitive, and your body holds onto water and salt a little less reliably. So a medication that a 30-year-old's kidneys would shrug off can put real strain on a 70-year-old's. Same pill, same dose, completely different impact. That's the whole reason this video matters. So let me show you the first one. The first medication is the group we call NSAIDs. That stands for non-steroidal anti-inflammatory drugs, and you almost certainly know them by their real names: ibuprofen, naproxen, diclofenac. These are the pills people reach for without thinking. For a sore knee, an aching back, a stiff hip, a headache. They're sitting in nearly every medicine cabinet in the country. And because you can buy them without a prescription, people assume they're harmless. That assumption is exactly the problem. Here's what's actually happening inside you when you take one. To do its filtering job, each kidney needs steady blood flow through those tiny vessels feeding the nephrons. Your body keeps a specific little blood vessel propped wide open using natural chemicals called prostaglandins. Think of prostaglandins as the hand holding the door open so blood keeps flowing into the filter. NSAIDs work by blocking prostaglandins. That's how they reduce pain and swelling. And for the painful joint, that's wonderful. But the same blocking action lets go of the door propping open that kidney blood vessel. The vessel narrows, blood flow into the filter drops, and the kidney is suddenly trying to do its job on a reduced supply. In a young person with plenty of reserve, the body compensates easily. In an older person whose blood flow is already lower, this can tip a struggling kidney into real trouble. The research here is consistent and well established. Studies in older adults have repeatedly linked regular NSAID use to both sudden drops in kidney function and faster long-term decline, especially in people who are even mildly dehydrated or who already have reduced kidney function. And here's what most people don't realize. The danger isn't usually the single pill for a headache. It's the daily habit, the every morning for the bad knee routine that goes on for months and years without anyone checking. So here's how to be smarter about it. If you're over 65, treat these as occasional tools, not daily companions. For ongoing aches, talk to your doctor about whether plain acetaminophen, which works differently and is generally far gentler on the kidneys, might cover you instead. Stay well hydrated whenever you do take an NSAID, because dehydration multiplies the risk dramatically. And please, never take an NSAID on top of a day where you've been sick with vomiting, diarrhea, or you simply haven't been drinking enough. That's exactly the situation where these pills do the most harm. Now this leads directly into the second medication, and this one catches people completely off guard, because it's the one they think of as the gentle stomach pill. The second medication is the group called proton pump inhibitors, or PPIs. You know them as omeprazole, esomeprazole, pantoprazole, and a handful of similar names. They're taken for heartburn, acid reflux, and that burning chest feeling, and they work beautifully for that. The trouble is that what started as a short-term fix for many people quietly became a forever medication. I've met patients who've been on these for 10, 15, even 20 years, and never once revisited whether they still needed them. Here's why that matters for your kidneys. There are two separate concerns, and both deserve your attention. The first is something called acute interstitial nephritis, which is a fancy way of saying the body sometimes mounts an allergic-type inflammation deep inside the kidney tissue in response to the drug. It can come on quietly, with no obvious symptoms, and slowly scar the kidney if it goes unnoticed. The second concern is broader. Large studies following people over years have found that long-term PPI use is associated with a higher risk of chronic kidney disease and faster decline in kidney function, particularly in older adults. Now, I want to be balanced here, because these studies show association, not absolute proof of cause for every person. But the pattern is strong enough, and these drugs are taken by enough people, that it absolutely deserves a serious second look after 65. So what do? You do not stop at cold turkey. Stopping a PP, I suddenly can cause a rebound surge of acid that feels worse than what you started with. Instead, the smart move is to ask your doctor a single question at your next visit. Ask, do I still need to be on this? And if so, can we try the lowest dose that controls my symptoms? Many people discover they can step down, take it only when symptoms flare, or manage their reflux with simpler changes like not eating late at night, raising the head of the bed, and losing a little weight around the middle. Working that out with your doctor, not on your own, is the whole game here. If you have an aging parent or a spouse who's been on a heartburn pill for years and just keeps refilling it, send them this video, because this is exactly the conversation no one ever sits them down to have. Now this is where things get interesting, because the third medication isn't something you take every day. It's something you take for just a week or two, and that's precisely why people let their guard down. The third one is certain antibiotics. Now, I want to be very clear and very responsible here. Antibiotics save lives. When you have a real bacterial infection, you take the antibiotic your doctor prescribes. Full stop. The issue isn't whether to use them. The issue is that a few specific antibiotics are harder on aging kidneys than others, and an older body clears these drugs more slowly, so they can build up to higher levels than intended. Let me explain what happens inside you. Your kidneys are the main exit route for many antibiotics. When your filtering power is already reduced by age, the drug leaves your body more slowly, The concentration in your blood climbs higher than it would in a younger person, and certain antibiotics at high levels can directly irritate or inflame the kidney tissue. Some of the older, very powerful antibiotics given in hospitals are well known for this. But even some common ones prescribed at home, including certain sulfa-based antibiotics often used for urinary infections, can stress the kidneys, especially if you're not drinking enough fluid while taking them. Here's the practical wisdom. Whenever you're prescribed an antibiotic, and you're over 65, it's completely reasonable to ask your doctor or pharmacist a simple question. Ask, is this dose adjusted for my kidney function? That one question prompts the prescriber to double-check, because the right dose for a 40-year-old may be too much for you. Drink plenty of water throughout the course unless your doctor has told you to limit fluids, and if you're already taking other medications on this list, mention them because the combinations matter, which brings me directly to the next point, and this is the one I promised would surprise you. The fourth medication is the water pill, what doctors call a diuretic. Names like furosemide, hydrochlorothiazide, and similar drugs. And here's why this one stuns people. Diuretics are often given to protect you. They lower blood pressure, they pull off excess fluid in heart failure, they ease swelling in the legs. Patients take them faithfully because they make them feel better, and their ankles look normal again. So the idea that this helpful pill could strain the kidneys feels almost backwards. But pay close attention to this next point, because it's one of the most important things I'll tell you today. A diuretic works by making you pass more water and salt in your urine. That's the whole point. But that same action lowers the volume of fluid circulating in your blood. And remember what your kidneys need above all else? Steady blood flow. When the circulating volume drops too low, blood flow to those tiny filters drops with it, and the kidney starts to struggle. In a younger person with strong thirst signals and good reserve, this rarely becomes a problem. But after 65, your sense of thirst naturally fades, so you may not drink enough to keep up, and you can slide quietly into dehydration without ever feeling thirsty. Now here's the part that ties this whole video together, and it's something every person over 65 should know by heart. There is a dangerous combination that kidney specialists actually have a nickname for. They call it the triple whammy. It's when someone is taking a diuretic, plus a blood pressure medication from the ACE inhibitor or ARB family, plus an NSAID painkiller, all at the same time. Each of these affects kidney blood flow in its own way, and stacked together, they can overwhelm an older kidney shockingly fast, especially during a hot spell, a stomach bug, or any day you're not drinking enough. I have seen exactly this scenario land people in the hospital with a sudden drop in kidney function, and almost every time the person had no idea. Those three medications didn't belong together in their situation. So what do? You don't stop your water pill, and you don't stop your blood pressure medication. Those may be genuinely protecting your heart and your life. What you do is become alert to the combination. If you take a diuretic and a blood pressure pill, that's exactly the situation where you do not want to be adding ibuprofen or naproxen on top without your doctor knowing. On sick days, when you're vomiting, have diarrhea, or simply can't keep fluids down, that is the moment to call your doctor and ask whether you should briefly pause certain medications until you recover. Doctors actually have a name for this plan. They call it sick day rules. Ask your doctor to write yours down for you. That single conversation can prevent a hospital stay. Let me tell you about a patient who taught me how quietly this can unfold. I'll call her Margaret. She was 71, sharp, independent, walked her little dog every morning, and proud of how few problems she had. She took a water pill and a blood pressure tablet, both for years, both working well. One summer she developed a nagging pain in her hip, and like so many people, she started taking ibuprofen every morning to keep up with her walks. Just an over-the-counter pill, she figured, nothing serious. Then a heat wave hit, and a mild stomach bug went through her family, and for about 4 days she barely ate and barely drank. But she kept taking all her pills right on schedule because that's what responsible people do. She came to me feeling unusually tired, a little confused with almost no appetite, and her ankles oddly puffy. Her blood work told the story immediately. Her kidney function had dropped sharply. She was frightened, and honestly, she had every reason to be, because she'd watched a friend end up on dialysis and the thought terrified her. But here's the hopeful part. Working closely with her own doctor, we paused the ibuprofen completely, temporarily held the water pill while she rehydrated under supervision, and got fluids back into her carefully over several days. Within a couple of weeks, her kidney numbers climbed most of the way back. Not all the way because some reserve was lost, but enough that she avoided any lasting crisis. The thing that saved her kidneys wasn't a new drug. It was simply understanding the combination she'd accidentally created. 2 years later, she's still walking that dog. She keeps acetaminophen instead of ibuprofen in her cabinet now, and she knows her sick day rules cold. That brings me to the fifth medication, and this one rounds out the picture, because it's a reminder that even the medications meant to control your other conditions need watching as you age. The fifth concern is certain medications that build up in the body when kidney function quietly declines, and the one I want you to know best is metformin, the most common first medication for type 2 diabetes. Now, metformin itself is generally not what directly damages the kidney. That's an important distinction. The problem is different and just as worth understanding. Metformin is cleared out of your body almost entirely by your kidneys. So if your kidney function has dropped, often without you knowing it, the metformin doesn't leave your body the way it should, and it accumulates. In rare cases, that buildup can lead to a serious condition where acid builds up in the blood, which can become a medical emergency. The lesson here isn't to fear metformin, which helps millions of people. The lesson is broader and applies to many drugs. As you age and your kidneys quietly lose filtering power, the dose of a medication that was perfect 5 years ago may no longer fit the kidneys you have today. Medications that leave through the kidneys can slowly accumulate, and nobody notices until something goes wrong, unless your kidney function is being checked regularly. This is also why certain other drugs, like some used for mood or for gout, need careful monitoring in older adults. So the practical step is beautifully simple. Ask your doctor how often your kidney function is being checked, and make sure it's actually happening at least once a year, more often if you have diabetes, high blood pressure, or take several of the medications we've discussed today. The test is a simple blood draw that gives a number called eGFR, which estimates your filtering power, often paired with a urine test that checks for protein leaking through. Those two numbers together are your early warning system. They can catch trouble long before you ever feel a symptom, because here's the cruel truth about kidneys. They rarely hurt or send obvious signals until a great deal of function is already gone. Now let me pull all 5 of these together, because once you see the common thread, you'll never look at your medicine cabinet the same way again. Every single one of these works on the same vulnerable point. The painkillers and the water pills choke off blood flow to the filters. The acid reducers and certain antibiotics can inflame and scar the kidney tissue directly. And medications like metformin reveal how reduced filtering lets drugs pile up to dangerous levels. After 65, with fewer nephrons, lower blood flow, and a fading sense of thirst, your kidneys simply have less room to absorb these hits. None of this means these medications are evil. Most of them are genuinely useful, sometimes life-saving. It means they deserve respect, attention, and regular review, instead of being taken on autopilot for years. And I have to draw one clear, firm line before I give you your plan, because it's the most important sentence in this entire video. Do not stop any prescribed medication on your own based on what you've heard today. Stopping a blood pressure pill, a water pill, or an acid reducer suddenly and without guidance can cause serious harm, sometimes worse than the risk you're trying to avoid. The power here is not in quitting. The power is in asking the right questions and partnering with your doctor to fine-tune what you take. So here's exactly what to do, starting today. First, tonight, take everything out of your medicine cabinet, including the over-the-counter bottles, and write down a single complete list of every pill, supplement, and as-needed remedy you take. Most people have never seen their full list in one place, and that list alone is powerful. Second, this week, book a visit with your doctor or pharmacist and bring that list. Ask 3 specific questions. Do I still need each of these? Are any of these doses too high for my kidney function? And do any of these combine badly, especially the painkiller and water pill question? Third, switch your default pain reliever. If you reach for ibuprofen or naproxen out of habit, talk to your doctor about keeping acetaminophen on hand instead for everyday aches, saving the stronger anti-inflammatories for the rare times they're truly needed. Fourth, ask your doctor to check your kidney function with that simple blood and urine test if it hasn't been done in the past year, and write the numbers down so you can watch the trend over time. And fifth, ask your doctor to give you your personal sick day rules, a short written list of which medications to pause temporarily when you're vomiting, have diarrhea, or can't keep fluids down. Keep it on your refrigerator where you'll find it when you need it most. You don't have to do all 5 tomorrow. Start with the list tonight and stack the rest in over the next couple of weeks. None of this is about living in fear of your medications. It's about taking the same care of your kidneys that you'd take of any organ you can't replace. Now, everything we covered today is about protecting your kidneys from the inside. But there's a piece of this puzzle that surprises even my longtime patients, and it has to do with the everyday foods and drinks that quietly stress your kidneys without anyone warning you, including some that are marketed as healthy. I made a video that walks through exactly which foods to be careful with after 65 and which ones actually help your kidneys heal. I'll put it right here on the screen. Go watch that one next, and I'll see you there. This is Dr. Robert Chen, looking out for you.